I'm sure you've all heard of jaundice turning yellow on the skin of a newborn infant. And I think many parents are concerned about that. In fact, that's quite a normal thing. Just about every infant turns yellow for the first few days of life, and then it normally just goes away. The reason the infant is turning yellow is because of bilirubin deposited in the surface of the skin. And bilirubin is a chemical from inside the body. The way this all happens is as follows. If you take an adult, yourself, myself, our red blood cells that you've seen on TV or in diagrams, they're the little red spheres, the red blood cells. They actually do not live forever. Sometimes people think that they do live forever, but in fact they die. And the average lifespan of a red blood cell in an adult is about 120 days. The average lifespan of a red blood cell in an infant is about 80 days. So let's take the adult first. What happens is one of our red blood cells will die, and they keep dying all the time, and they're replenished from new red blood cells coming out of our marrow. So the red blood cell that dies, let's think about that, it opens, and when it opens, it lets bilirubin, which is in the red blood cell, open and loose in our blood, in our circulating blood. So that bilirubin circulates all over until it gets to the liver, and the liver sucks it out, and it has an enzyme in the liver that breaks down that bilirubin, and then the bilirubin is transported into the gut, and it is disposed of by the body. And that is how bilirubin is controlled by an adult. Now let's take the little infant. The infant is inside the mother. The infant has red blood cells, and as I said, those red blood cells die, and just as in the adult, they're replenished by the marrow of the baby. So in the baby, the red blood cell opens up and starts traveling through the blood system, and the difference is that before it gets to the liver, it gets to the placenta. The placenta filters out the bilirubin and puts it into the circulation of the mother. Then the baby's bilirubin is now in the mother's blood system, goes through the mother's blood system, goes to the mother's liver. The mother's liver picks it up, sucks it out. The enzyme in the mother's liver breaks it down and is excreted out of the mother. So at birth, the baby has never had to deal with bilirubin. So now the cord is cut, the baby is now free out from the mother, and now the baby's blood cells continue to break down. They break down, the bilirubin circulates inside the baby's cardiovascular system, it then hits the liver, and the difficulty is that the liver has never had to dispose of this bilirubin before. So the level of that enzyme that I told you about is low in the infant, and it takes 3, 4, 5, 6 days for that level to go up. And so because of that, bilirubin builds up in the baby's body, and some of that is deposited on the skin, and that's why infants turn yellow. So we follow that very carefully, because it's okay to get yellow, but it's not okay to get too yellow. It's not okay for the bilirubin to go up too high, because that can cause damage to the baby. So you will see us paying quite a lot of attention to bilirubin and to the color of the skin in the first few days of life. Now, just as the bilirubin gets deposited in the skin, the bilirubin also gets deposited in the whites of the eye. And so the sequence is as follows. The bilirubin builds up in the blood, gets deposited on the skin, so the skin starts to turn yellow. Thereafter that, the bilirubin is deposited on the whites of the eye, and the whites of the eye start to turn yellow. Then the baby's liver starts to kick in, getting rid of bilirubin, and slowly but surely the yellow color of the skin goes away. After that, then the yellow coloring of the whites, the conjunctiva of the eye, it goes away from there. So the sequence when the bilirubin goes up is that the bilirubin goes up, you see it on the skin, then you see it in the eyes, then as it starts to go down, the skin color turns the right color subsequently, and then the whites of the eye turn white again. So we'll follow that carefully together.